Okay, on to our next type of tens. So by now you should have finished up our conversation on tens and been able to start to practice with those waveforms. Now we're on to high volt, or sometimes called high volt pulsed stimulation, or HVP. So the high volt stimulation is done on specific machines that allow high volt. And the machine has to have the capacity to exceed 150 volts, usually somewhere up to 500 volts. And so what we talked about so far with the biphasic and with Ionto and our DC currents, those have been low voltage stimulants. So this high volt tends to have a lot more depth of penetration, so you can get into deeper tissue. And it creates what's known as a twin-peaked monophasic pulse current. So it looks like two little mountain peaks. That's your pulse. And it has a really long interpulse interval. And what that does is, because of the high voltage, that keeps it at a sensation that we're able to tolerate. So that when we have this really high voltage, in order to control the current, okay, thinking into some of our different calculations for electricity, we really need a really short pulse duration or phase duration in order to do that. And so the pulse duration or phase duration is actually preset on the machines when you're using high volt, because of the risk of having too much electrical current running through the individual. We tend not to be able to target our C pain fibers just because of that really short pulse duration. When you look at our strength duration curve, we don't get over to the right well enough. And so it's not really great for our level 2 pain control. We can target level 1 and level 3. You can technically also do muscle re-ed, but it's not my favorite way to do muscle re-education. We have two different types of waveforms that we can do that with, our NEMS and our Russian. So it again tends to really mainly be focused on the pain relief. High volt tends to actually have more potential also to do some of that, the pH changes with the positive and the negative current. Because we're on a monophasic, we choose whether it's positive or potentially negative, and so you can do some of that. Not as well as you can do it with a DC current, because we're pulsed, the ions can diffuse versus on a DC where it's that constant flow. But some people have shown results with kind of that alchemy idea. So the positive and negative charge can potentially be used. So again, you would want maybe more of a positive charge for acute, getting more of that hardening, and then a negative charge more for chronic, more of that softening. So some of the effects that we have, the wound healing, that can go along with the positive and negative charges, though we wouldn't want to put the pads directly over active wounds. We would want the pads encasing the wound. High frequency, low amplitude stimulation, so that would give us more of our level 1 pain relief, or we can get to and that would again give you that pins and needles sensation for the wound healing. So there's research that with pressure ulcers, so individuals who are bedridden and get ulcers from that, 45 minutes of a high volt treatment in kind of that positive flow has shown positive results in healing those ulcers faster than without the stim. So it can kind of enhance the natural way the tissue recovers. But for the most part, we're using it for pain control. So again, high rate or low rate tens, and all of those indications, just kind of like we talked about for our tens conversation. You can also potentially get some reduction of edema because we can stimulate the motor nerves. Again, those A alphas that kind of go along with the A deltas, we can get kind of a pumping mechanism to move that edema out. We'll talk more about that when we get to neuromuscular stimulation, but you can potentially set that up with high volt as well. So the advantages of our high volt is a lot of the same advantages we had for our tens. Slightly more advantage potentially with wound healing because it's not an alternating current. We can set the polarity. It's pretty versatile. Again, we could get that edema reduction. We can get our level 1 or our level 3. Disadvantages, it's not as good as the NEMS, our neuromuscular electrical stimulation that we're going to talk about next in order to get muscle contractions. High volts tend to not be portable devices, so we don't get that idea as we would with TENS. And the polarity hasn't been as well proven, and so using that can be a little tricky. Indications, again, wound healing and pain relief, potentially reduction of edema. Contraindications are going to be all of our typical stim. We have a little bit more concern, especially with the high volt stimulation of the epilepsy that we talked about in our general contraindications because of kind of the high voltage. Also thinking precautions, again, our impaired sensations. We want to make sure, depending on the level, that they can tolerate a muscle contraction if we're trying to do our level 3. Pre-application steps are all going to be the same as when we talked about in TENS. Preparing the patient psychologically is the same. The procedure should feel, the sensations should feel very similar, mild kind of tingling or up to those muscle contractions. Again, it shouldn't be painful. We're not going to electrocute them. We can demonstrate on ourselves. Again, get the patient comfortable, expose the area, drape it if it's a sensitive area, clean the pad or the where the pads are going to go, where the electrodes are going to go with some alcohol, maybe shave, maybe a braid. And then it's going to be getting the equipment prepared. So we turn it on and we set our parameters. We get the electrodes attached, making sure we have good contact. And then we have our application, so setting our parameters. So pulse duration is going to be preset. So our rate or frequency are going to be at those same levels that we had for our TENS, depending on our goal. So our level 1 is going to be, again, our 80 to 200. Some books say 60 to 120, somewhere in that range. Our level 3 is going to be our low rate, so it's going to be 1 to 5 or potentially 2 to 10, so somewhere in that range. And again, we're going to kind of pick a number and start with, and you're going to get to experiment with this a little bit. And then our intensity, level 1 is going to be the submotor, so only the pins and needles. If we get to muscle contraction, we back off. Remember that we might have to move the pads around. And then our level 3 is going to be for that muscle contraction. So we'd increase the intensity until we get to those results. If we need to find a motor point or get off a motor point, we would potentially do that as well. Our dosage is the intensity, so whatever's comfortable for the patient, that gets us our results. Length of time, if you are usually, again, kind of looking at a 30-minute treatment, maybe as low as 15 because of the high volt. You can just kind of see what your patient is tolerating. Again, think about accommodation. Usually high volt doesn't accommodate as quickly as the biphasic, but you would want to be checking on that. Frequency, you can do it about 3 times a day with maybe 3 to 4 hours in between, and you're going to use this until you're meeting your goals. And if you're not meeting your goals in kind of a timely manner, then we need to think, is this the best tool in our toolbox for this condition? And then our post-application steps are all the same, right? Turn it off, put the pads away, check the area, double check in with your patient again about their pain scale and their patient-oriented outcome measure. Give any instructions, home self-treatment, get them to schedule their next appointment, their level of participation so they know what they can do, and document everything. And then our same maintenance, our weekly, our daily, our weekly, and our annual kind of maintenance that we've already talked about.